Hi, this is Dr. Charlotte Charfen, board certified emergency medicine physician who has been practicing on the front lines for 20 years. I want to talk to you about hydroxychloroquine and chloroquine for the use in coronavirus, simply because it's been all over the headlines and I've had so many questions about it. First, I want you to understand this drug is actually quite old. It is not new. We've had it since 1949. That's when chloroquine came into use for malaria, then followed by hydroxychloroquine in the mid-50s, which has less side effects, thank goodness, because they both have side effects. We know that. We've got the data over that period of time. Two big ones I want to tell you about. One is permanent vision damage that could lead to loss or blindness. The other one is effects on the heart that can lead to arrhythmias and cardiac arrest, meaning death. Those are two biggies. There's a lot of other side effects, okay? The issue I have with that is there's a really narrow safety window for this medication, meaning at certain doses, it's very effective. You go right outside of that, it can be quite toxic. So that's one important thing to keep in mind. We don't know actually the exact dose we should be using, if we should be using it for coronavirus, and what's being recommended is actually higher than usually the cutoff for these drugs. So that's one of my issues with the medication. But why did this even come about? And that was because of a study that was done in vitro, or which means in a test tube out of China, that showed that Plaquenil's, the other word for hydroxychloroquine, might actually work against this virus. And that's actually exciting. I mean, I think that's why we're all like, oh my gosh, finally something, right? Well, test tube studies do not often translate into human studies, but that is the reason that the FDA basically on March 28th, I think it was, released an emergency order so that in the hospital setting, we could actually use this medication for patients that did not qualify for clinical trials. So this is kind of a compassionate use order, meaning, okay, we don't have enough studies to say it really works, but at this point, if they're in the hospital, they're already going to be pretty sick, so we're going to throw the kitchen sink at them, and this is one of the things that we can do. The FDA did not approve this drug to be used in the general public in mild symptoms. They did not approve this drug to be used for prevention or prophylaxis or treatment of coronavirus. So I just want to make sure everybody understands that. Yes? Okay. So there are other studies that have been published, very small studies, not well-powered studies. I'm going to actually attach them so you can look at them. They're not that impressive. Some show some benefit, some don't. But at this point, we don't have these big, powerful studies that we as scientists and medical doctors want to have. It's not there yet. Those are in process, I know that, but we don't have that data. And so we are having to use our own clinical judgment, especially within the hospital setting. And most people are using this medication for our sick patients. Again, no studies showing that it works on the outside. But again, I'm going to try to remain skeptically optimistic. If I see something that shows it would be beneficial to a patient that's got mild symptoms, then I will start using it, but we're not there yet. One thing I want people to understand is because of the hype around this, what's happening is, again, the same thing that you saw with toilet paper. Nurses, doctors, and patients are trying to hoard these medications, okay, which makes it not available for our really sick people. That ain't cool. I have to tell you, I get so annoyed. I do telemedicine, and I have an application that I use called Push Health. By the way, my code is Charfen. If you ever abuse my code, I will be turning you over to somebody. No, actually, I'll just flag your chart. So what I've noticed is that this app was used for people to be able to get their medications, especially during this pandemic, but it's a great app. So you can fill your blood pressure medicine, your asthma medication. That's what it's really there for. Once this went viral across the US, my inbox has been just slammed with people telling me that they are all of a sudden going to Africa and they need the anti-malarial pill. Or all of a sudden they just developed rheumatoid arthritis. That really pisses me off when you lie to a physician, but I get it. People are scared and they're just trying to figure out a way to get this medicine. I really do appreciate the patients that reach out and say, I'm scared and I just want to have this because I have risk factors, or I have symptoms of COVID and I want to use this medication to treat that. That gives me the opportunity to actually educate and say, we're not there yet, okay? But just so you do know, there are several states, Texas, Idaho, North Carolina, there's probably a few other ones, their board of pharmacy has actually shut it down so that you cannot prescribe this medicine off-label, okay? In some states you still can, but that needs to really be under the direction of a physician that's looked at these studies, can understand and tell you the side effects of these medicines, and you can make that choice. But right now, I cannot, in good conscience, recommend it to people in the general public that have very mild symptoms. That may change as more studies come out, but I just don't think we're there yet. What you can still do, and I hate to have to keep saying it, but I think it's so important, these guys, wash your damn hands. Wash them. Don't touch your face. Social distance, stay at home. We can talk about masks in another video. They can be helpful. Again, they got to be used the right way, okay? But be safe. If you have any questions, you can always reach out to me. I've got a website, drchacha.com, drchacha.com. I'm on social media as well. And I'm gonna link the article that's really simple, but I think gives a lot of really good detail so you can understand it as well as look back at this video if you need any guidance. Have a beautiful day. Thank you.